Hello and welcome back to PT Talks with Dr. Steve, your physical therapist. We're going to jump right back into this article. This is wrapping up our multi-video segment here on pain and why pain is a good thing. Feel free to check out part 1 and part 2. They will be linked at the end of this video. Please like and subscribe if you like this content and want to see more. Turn on those notifications. And thank you so much for being here and joining. If you have any comments or questions, please post them down below and I will answer every single one of them. Let's get into fear of movement and talk a little bit about it. Kinesiophobia is the word that is assigned here to the fear of moving, which is a huge problem. And this example in here, we could talk about a lot of different examples, right? But this example cites a patient coming in about 6-7 weeks after surgery. Her ankle was fused. And that's a surgical technique where they actually fuse the bones together with plates and screws. You can imagine, pretty rough injury had to have occurred here for the ankle to be in that state, to be fused, the bones to be fused together. She had a history of enjoying traveling, but now was afraid she'd break something in her ankle. So what I hope that these videos are helping people out there to understand, whether you're lay people, science people, healthcare professionals, is that every example we've painted helps to paint the picture of the person a little bit better than just saying a patient came into our clinic 6 or 7 weeks after surgery, after an ankle fusion. Let's dig deeper. She had enjoyed traveling. She was afraid, very justified fears now that she was going to hurt herself more after a surgery, which probably, we get into it, talked about if we dug a little bit deeper, she probably wasn't doing much of anything, and she was certainly not doing the things that she enjoyed. So it says that she loved to dance. And so the PT working with her suggested that they dance in just a little bit, 10 feet one way, 10 feet the other. And they did that for a little while, took a break, and then that was the whole session. And you think, well, what good was that? And the good in it is that the PT found meaning and made movement meaningful. And I think that's the overarching theme here. And it is, if you talk to any PTs who are doing it right, they really try to find meaning in movement and help people understand that they can get back to the activities they love. It does just sometimes take a little bit of movement and then pair that with a little bit more movement and then a little bit more. And it's the stepwise situation here that you can build, and it accumulates. And you start talking about how you become, as a creature here, as an adaptable creature, as we all are as humans, we have this ability to take on more capacity, take on more work and volume, and be able to withstand that without without as many problems as the body gets stronger, as you get more confident. So I love that. And it goes further to talk about how the PT, in doing all of their tests and measures, already knew that she had strength, right? She had functional strength to do all this. What was really holding her back is that she needed to be convinced that she could use this body part again. And that's what a lot of people, I think we meet a lot of different people in different paths whenever they find us as PTs. We have to convince people, especially if we rule all the big bad stuff out and we figure out, okay, we're dealing with this and that musculoskeletal, no other problems, no other reason to refer out. And we go, okay, we need to convince that movement is good, but we've got to find the right movements. We've got to find the meaningful movements that this person will appreciate and that they'll find joy and be able to get back to some of their goals that they're not doing currently, and help address these fears, these true real life fears. So they were able to have a successful session. And we talk a little bit more as we go into the rest of this article about other self-management strategies. And some of these can be effective. Deep breathing, relaxation techniques, restorative sleep. Cannot talk about that enough, especially when you're trying to heal, how important it is to get sleep. I can't tell you how many people that I've interacted with who are in PT off and on sometimes, or brand new, or there's so a myriad of different examples that I could give you where sleep is at the bottom of their list, and or it's just not anywhere near the top. And you're really missing a low-hanging fruit if you're not looking at sleep as a means of healing, as a means of restoration, recuperation, all the things that come with sleep. Also back to the importance of what does it do for the brain. And it's really, really, really good for the brain. The body, yes, but it's really good for the brain and your psychology to get enough sleep. So can't overstate that enough. And, you know, I think there are different ways to help people with these types of interventions, right? I mean, there are so many free apps out there that are related to mindfulness and meditation, things that people can try. And why I bring this up because a lot of the times I base my ability to help somebody here with how much of a risk reward it is. And if there's no cost and it's something you haven't tried, you can try it without really any risks associated with it. Working on your breathing, working on relaxing, working on de-stressing comes with the idea here that the pro is that you might be a little more relaxed, which can help you completely, your entire existence. The con is that you spent some time trying and you might not end up with the result that you wanted. And I find that a pretty good deal. It's a pretty good bargain. So it goes on further. We talk about culture and beliefs influencing pain. And this is huge. I mean, I've worked with so many different people, so many different backgrounds, education levels, you know, men and women, children of all ages. And it's important to understand that where you come from, we talked about this in the first video a little bit, how your memories and experiences early on in life can dictate how you respond to pain too. There's a lot there to unpack, but we know that culture and beliefs can influence pain. So I've had to definitely go at treating and educating different people from different backgrounds carefully and a little bit differently, because people may come at you with a completely different belief system than the next person. And so you have to keep that in mind, and you have to understand that someone's culture and how they're raised and what they believe can definitely impact pain. So it's just another way for you to check yourself and check some of that also against the science, what we're talking about here, and helping people understand things maybe a little bit differently. I've had situations where I'm telling people some things like these in these videos that you've seen now up to video 3 here, that people have never heard before. And they're like, I didn't know that. I've had some people say, you know, to a certain percentage, they know what I'm talking about. And it's always interesting to find where people are and then meet them in the middle. So I think that's just another thing they talk about here in the 9 things you should know about pain. Point 2, if you remember, research has demonstrated that we all experience pain in individual ways. While some of us experience major injuries with little pain, others experience minor injuries with a lot of pain. This next part talks about relieving pain to return to duty. And it talk about working with service members from the Navy or Marines who are dealing with chronic pain, which is a large percentage. I've worked with many vets. Thank you for your service and for what you've done for the country. But it comes with a price. And a lot of these people are struggling, and they don't have necessarily the best avenues to get the help for, again, a plethora of reasons. But they were able to do some research here in an 8-week program utilizing an interdisciplinary approach. They looked at bringing everybody who could help here on board and really had a good solid team. And I think that's the first point in here when you start talking about chronic pain, is that coming at it from a team approach with a lot of different ears and eyes can be helpful. So we had a PT, a psychologist, clinical nurse educator, and we had also a pain management physician. So they went through the program, right? And they tracked patients 1 week, 4 week, 8 week, and they were making adjustments. So you see the team's able to work on the client, and then the team's able to relay information to each other. So you just almost have this team of people here who are able to make fine, tuning type adjustments, able to do what they need to do in their own scope and give some information to another person. And it's all building. And what is it doing? It's putting the client, the patient, at the very top. Instead of what we see when people aren't really working together is that the patient gets lost in the shuffle. And I've heard that phrase a ton. And patients, they feel disgruntled and they feel frustrated and upset sometimes when they find me and they've been dealing with chronic pain, is that I just feel like I got lost in the shuffle and that I fell through the cracks and the gaps. And I got this person over here telling me this thing and this person over here telling me this thing. And they're just getting conflicting messages that it doesn't help them. All the while, someone else is coming in and they're just prescribing me medications that I don't even know if they're doing anything. I feel like after a certain number of years, you've heard every scenario. And so you really look at this and go, wow, they really got something right here. And we could really learn from this. So they educated the patients too. They talked about pain science, like what this is. This is pain science. These part 1, 2, 3 videos on why pain is a good thing is the research that we have on pain science. Neuroplasticity, that refers to how the plasticity refers to how things are moldable and changeable. And we as humans are moldable and changeable. Neuro refers to the nervous system, right? So the brain and the neural pathways are plastic. They're able to mold and change depending on what we do from a treatment standpoint, right? Physical therapists, we talk all the time about neuromuscular re-education, right? We're re-educating the brain and the body here with a lot of the things that we're doing. And that's the hope, is that we can re-educate the system and use that plasticity to help bring about some change here that's good and positive. And so pacing, being able to pace and being able to work on goals in a stepwise fashion, not all too soon, too fast. And so the bottom line here, pain is multifaceted. I mean, we understand that it's physical, it's emotional, it's sensory, that's senses, that's how you feel, right? Cognitive, right? Thinking. Environmental factors such as stressful work environment, marriage problems, death in the family, or trauma all contribute to the patient's pain experience. If there's one thing you take away from this video, is that portion of the article right there. It's so true. And we undervalue that. We don't talk about that enough. And here we are. We got to talk about it. I've had people who have no other musculoskeletal, there's no other mechanical or physical reason why they're having their pain. We dig into their work and they hate their work. They hate their boss. They feel stuck. They can't get out of it. And that's a helpless type feeling, right? That's a bad situation psychologically, emotionally. And we get talking about that. And as soon as I ask the question, so what if you were able to take a week off from work? What do you think would happen? And every time, I'm not joking, the answer is I would feel better. And so we know work for people, as necessary as it is for people to make a living and to put food on the table and to support their family and to support their futures, it is a huge stressor for people. And we as PTs help with potentially modifying work environments, help with stress relieving techniques, different things that you can do during the workday. There are some easy things that you can incorporate into your work environment. We just have to know what's going on and what you're doing currently. There are some easy things that can have a have a big change in effect. I've seen that time and time again. So we talk about this is another thing, and I smile and laugh a little bit because I as I've gotten older and more into the field, and you just learn things as you're a clinician. You learn how to phrase things, and you learn to kind of understand that it's important to phrase things for people who may potentially accept that the wrong way. You don't want anybody to take you the wrong way. And so, this all in your head and that's okay part right here, I really just want to talk about a couple of things. In the past, healthcare workers may have told chronic pain patients that the pain was all in your head. And we try to assure patients that they haven't made up the pain, that it is in your head and it's supposed to be there. It's a subconscious experience in which your brain is overprotecting you. I think the phrase that it's all in your head is this, like, I'm crazy, I'm insane. And it's like, that's not the message that PTs or anybody's trying to relay. But I think that's the way that people hear that, is they go, what do you mean it's all in my head? And that's kind of an American idiom that we kind of have, is that it's all in your head, man. Really what we're saying is that it's all in your brain. And that's really what we're trying to help people understand, is that it's in your brain. And that this is an experience in which your brain is trying to overprotect you. It's no different here than talking about the mom who makes her child put on too much padding before riding a bike, right? We have to learn to take off excess protective padding and instead wear an appropriate amount for a protective response. That way, when you have a pain flare up, you can trust that you have injured something or were close to injuring it. Maybe you lifted a bit too much weight, but you can trust this input. It's difficult not being able to trust your body. Gosh, that's such a simple statement, but wow, that's something that I've seen so much time and time again in my practice and working with people, is that people just aren't able to trust their body because they might be using painkillers and the pain signals are blocked. And then they're in a whole host of trouble the next day because they weren't feeling the pain, and then it all caught up with them. So, as we go through the rest of this, I wanted to finish on the opioid epidemic, and we've talked a little bit on opioids throughout part 1 and part 2, but this last part of the article just wraps it all up nicely. And we talk about the APTA. That's our American Physical Therapy Association. That's our national association as PTs. They have a fact sheet, the opioid epidemic, what PTs and PTAs need to know, states that APTA is following Centers for Disease Control and Prevention guidelines and its recommendation for non-opioid approaches to chronic pain. Physical therapy is a safe and effective alternative to opioids for long-term pain management and prevention. PTs made the front lines. And I think that's really important for people to understand, is that they're showing now, not just with what I just read, but they're showing with subsequent research that PT is a healthier, safer first-line defense for chronic pain. And people are catching on. People are understanding that. So here we are to kind of ring the bell and sound the alarm. The CDC does state that opioids can be appropriately dosed and used for cancer treatment, palliative care, end-of-life care, and certain acute situations. We're not bashing all situations where opioids are used. What we're bashing is how they've been misused and mismanaged and just recycled over and refilled over and over and over again for people to get to the point where we are now in society, where we're in an epidemic and we see this crisis taking lives at extraordinarily saddening, frustrating numbers. The rest of this talks about, this is so important. We don't talk about this enough. We don't learn about this enough in just regular society. This is a PT here talking about the efforts to get people to try motion and physical therapy first may be facilitated by educating them about endogenous opiates. That means that we have opiates already in our bodies, and the natural, here they are, the natural painkillers people produce through movement. That's why PT's on the front lines for treating pain, and especially chronic pain, because if we can find, as PTs, we're trained and we're experts in finding the movements that you need to be doing, considering whatever situation that you're in, the best movements for you to help get these natural painkillers flowing through your body, that they're actually produced through movement. At low levels of exercise, about 30 minutes, we produce endocannabinoids, which produce a feeling of well-being. Many of my patients want immediate pain relief. If I can guide them to accepting the chemical changes that occur with movement, it may keep them from taking opioids. It's not hard. It's just that we've been led astray, and that we've been, unfortunately, led down a road here where we're in the situation that now we have to help people see this and hear this and understand this. And it's not easy because of the situation that we're in right now, but it is possible. It talks about here, and here's our pacing example. If chronic pain patient says that more than 5 minutes of movement is impossible, what do you think we do? You're not going to put somebody who's 5-minute tolerance and say, go work out for an hour. That doesn't make any sense, right? Instead, they'll start with the individual at 5 minutes, maybe a little bit less, if depending on the person, right? But she'll try to have the patient perform that movement or exercise 6 times a day to total 30 minutes. And maybe you do that gradually or stepwise. Maybe you don't do that the very first day, but you say, can we get 5 minutes of exercise? And the next week, can we get 10 minutes? Can we get 15? And then maybe you also just throw in a little bit more and see how they respond. But we're always trying to find that happy medium, that place where people can exist with movement. Again, getting the natural benefits from movement, and helping them with their pain naturally. So that wraps up our third video and this article that I've been eager and excited to get through. And we made it. And so thank you again. I hope that you've enjoyed this content. I hope you've learned something. I hope you share it with your family and your friends, people who might need to see this. And again, comment below. Any questions, go ahead and put them below. I'll get to them. Thank you for being here. This has been PT Talks with Dr. Steve, your physical therapist. It's been a pleasure, and I look forward to seeing you in the next video. Take care. Stay safe. Bye.